In space, no one can hear you scream. But something else happens up there. Something silent. Something invisible. The human skeleton starts to disappear. Not breaking. Not cracking. Dissolving. An astronaut on the International Space Station loses 1 to 2% of their bone density every single month. That is the same amount a postmenopausal woman loses in an entire year. 6 months in space. A decade of aging on Earth. This is not science fiction. This is happening right now. We think of bones as permanent, as the scaffolding of the body that stays the same from childhood to old age. That is a lie. Your skeleton is alive, constantly tearing itself down, constantly rebuilding. Every day, your body destroys old bone cells and deposits new ones, calibrating itself to the forces you ask it to bear. Walk, run, lift, jump. Gravity pulls. Your bones push back. But what happens when gravity disappears? What happens when the load is lifted completely? To understand what happens in space, you first have to understand what happens on Earth. Your bones are not dry, dead sticks. They are living organs filled with blood vessels, nerves, and 2 types of cells locked in eternal war. Osteoblasts, the builders. Osteoclasts, the destroyers. In a healthy, active body, these 2 forces live in balance. The signal that maintains that balance? Mechanical load. Weight. Gravity. Every time your foot hits the ground, sensors inside your bones detect the shock wave. They send a message, more load. Reinforce. The builders get to work. But if you stop moving, if you are bedridden, or if you float, the message changes. No load. No need. The destroyers keep working. But the builders stop. The bone thins. The architecture crumbles. This is not disease. This is physics. Use it or lose it. At the cellular level. In the early days of human spaceflight, no one knew this. When Yuri Gagarin returned after 108 minutes, his bones were fine. When the Apollo astronauts returned after 8 to 12 days, they reported strange weakness. But no one measured the skeleton directly. Then came Skylab, the first American space station. 1973. Missions lasting up to 84 days. When the astronauts came home, doctors ran tests they had never run before. Bone density scans. The results were alarming. Some astronauts had lost more than 10% of their bone mass in less than 3 months. NASA called it the Skylab anomaly. No one understood why. No one knew if it would stop. Then came the Mir station. The Russian missions. A continuous human presence in space for years. The bone loss continued. Month after month. Astronaut after astronaut. By the late 1990s, the pattern was undeniable. The weight-bearing bones, the spine, the pelvis, the femur, the tibia, were the most vulnerable. The upper body, which does less work on Earth, lost density more slowly. But the lower body? The foundation? It was being eaten alive. Researchers calculated the rate. 1 to 2% per month. Compare that to a postmenopausal woman with osteoporosis. 1 to 2% per year. 1 month in space equaled 12 months on Earth. A 6-month mission? The equivalent of a decade of aging. The astronauts were returning with the skeletons of people 10 years older. NASA had a choice. Abandon long-duration spaceflight. Or fight back. They chose to fight. The first countermeasures were primitive. Elastic bands. Stationary bikes. Hopelessly insufficient. Astronauts still lost bone. Just more slowly. So NASA built something new. The Advanced Resistive Exercise Device. ARD. Installed on the International Space Station in 2008. ARD uses vacuum cylinders to simulate the resistance of free weights. In zero gravity, astronauts can now squat, deadlift, bench press. In space, they spend 2 hours a day on this machine. Every day. For 6 months. It is brutal. It is exhausting. And it is not enough. Even with ARD, astronauts still lose bone. The loss is slower. But it does not stop. So NASA added pharmaceuticals. Alendronate. The same drug given to osteoporosis patients on Earth. Astronauts begin taking it 3 weeks before launch. Continue throughout the mission. The combination of ARD and alendronate produces the best results NASA has ever seen. Partial protection. Not full. Partial. For missions of 6 months or less, the bone loss becomes manageable. But for longer missions? Mars, 3 years. The existing countermeasures are not sufficient. A Mars astronaut could lose 30 to 50% of their bone density. At that level, bones shatter under normal use. Walking becomes dangerous. Standing becomes a risk. The human body was not built for this. Here is the part NASA does not like to talk about. Recovery. When astronauts return to Earth, their bones begin to rebuild. Gravity returns. Load returns. But the old architecture does not fully come back. A 2017 study in Scientific Reports followed astronauts for 12 months after landing. They measured bone strength, total density, cortical bone, trabecular bone. After a full year back on Earth, every single measurement remained below pre-flight levels, between 0.9 and 2.1% lower. Permanently, astronauts on longer missions recovered less than those on shorter missions. Some damage appears to be irreversible. The trabecular bone, the spongy, honeycomb-like structure inside your vertebrae and joint ends, does not fully regenerate. Once that architecture collapses, it never returns to its original strength. Researchers calculated the real cost. A 6-month mission accelerates skeletal aging by approximately 10 years. An 18-month mission? 20 years. A Mars mission? Unknown, but likely catastrophic. The astronauts are not sick. They are not injured. They are aged. The microgravity environment steals time from their skeletons. And no exercise machine, no drug, no countermeasure has yet stopped that theft entirely. But here is where this story turns. What happens to astronauts in space is happening to millions of people on Earth. Right now, bedridden patients, elderly people with limited mobility, anyone confined to a wheelchair. Their bones are unloading too. Just slower, just less visibly. The same mechanism, the same destroyers, the same silent thinning. It is called disuse osteoporosis, and it is a hidden epidemic. But there is hope, and it came from space. The research NASA conducted to save its astronauts is now being used to save patients on the ground. The ARD protocol, the alendronate timing, the mechanical loading research, all of it is being adapted for terrestrial clinical practice. Low-magnitude, high-frequency mechanical stimulation, developed from ISS experiments, is now being tested in elderly populations. The basic framework has transferred. Mechanical loading is the primary signal for bone maintenance. No loading, no bone. This knowledge, hard-won at a cost of millions of dollars and decades of human risk, is now free. It belongs to every doctor, every physical therapist, every patient. The astronauts gave us something we did not have before. A complete model of how the skeleton responds to unloading. A warning about what happens when we stop moving. And a roadmap for how to fight back. The human skeleton is not a scaffold. It is a conversation between your body and the planet. Every step you take, every weight you lift, every floor you stand on, gravity is speaking to your bones, telling them to stay strong. But when that conversation stops, the bones forget. They do not break because they are weak. They break because they were never told to stay. The astronauts on the ISS are our canaries in the coal mine. They show us what happens when we leave gravity behind. And what they show us is simple. The load is not a burden. The load is a signal. Without it, we fall apart. So the next time you feel the ground beneath your feet, listen. Your bones are listening to you. Do not stop moving. This is what space taught us. This is what we leave you with.